Hair loss both in men and women is one of the most common concerns I see in my office as a board certified dermatologist. So I'm going to break down types of hair loss, both men and women, what a consultation looks like, some possible causes for your hair loss, as well as what you can do both at home and at the office, more natural kind of approach with supplements, as well as some more medical in case those more natural approaches don't work. We're gonna go through a lot of information, so grab your notes and hopefully you guys find this helpful. A little bit about me, I'm a board certified dermatologist and I practice here in Tucson, Arizona, as well as Los Angeles. So as a board certified dermatologist, I see medical patients, cosmetics, and surgery patients. And with my medical patients, hair loss is definitely something that I really like to focus on. I know this can be such a difficult thing for patients going through it, whether if you're male or female, and doesn't matter how young or mature you are, it can be very difficult and people almost feel like they don't have control over the situation. To break things down, there are two main causes of alopecia. Alopecia just means hair loss. There's alopecia areata, which is the coin-shaped autoimmune type of hair loss. And so sometimes people think that when you say alopecia, it's actually the autoimmune type, but that is just a specific type. With male pattern hair loss, we usually call it like androgenetic alopecia. So just in general, it's good for you to know in case you get diagnosed or in case you're looking on the internet. Alopecia just means hair loss in general. There's two different types of alopecia, which is hair loss: scarring and non-scarring. We'll start with non-scarring first, since this is the most common type. Non-scarring, some causes for this just includes genetic, so androgenetic alopecia, or male or female pattern hair loss. This is due to genetics kind of in this frontal area. There's a few scales that sometimes we go through, like Norwood scale, especially for men, to kind of figure out where they are in their stage of their hair loss, or if we want to see improvement, we kind of go with that scale sometimes too. Another cause of non-scarring alopecia is autoimmune. So it could be alopecia areata, alopecia universalis, totalis, and this is when your body is attacking your hair follicles. It thinks it's foreign and it basically gets rid of the hair, drops them all out. But when we decrease and actually treat medically, this hair can come back. So that is another type of non-scarring alopecia. A very common cause of non-scarring alopecia is something called telogen effluvium, which can happen due to a stressor in your life. It could be a medical stressor, such as surgery, intense weight loss, even COVID, sometimes the vaccine. So your body has this really big immune response. And then also like a sickness, other sicknesses, being in the hospital. It could be hormone changes. So post pregnancy, when you deliver a baby, your hormones kind of dip down, and that's when you'll have this like hair shedding after pregnancy. You can also see this hair shedding after other hormonal changes, like starting or stopping birth control. And so this is really common thing that we see. Other causes can be some mental stress too. So I see a lot of patients just going through, a really tough year, and that can absolutely contribute to telogen effluvium, which is this stress response of losing. So instead of losing 100 strands of hair, as we normally do, with telogen effluvium, you lose 300 strands of hair, which that can be really scary. I've had 2 bouts of it before, and from stopping birth control actually. And what's really difficult about this is it doesn't, with the hair stages, things don't happen right when the insult happens. Things don't happen right when you have that stressor. Things don't happen right when you stop that medication. It takes a couple months. So it takes 3 to 4 months after that incident. And then telogen effluvium, where you're losing 300 hairs instead of 100 hairs, takes a couple months to happen as well. So that lasts a couple months. If it goes into more than 6 months, and that's chronic telogen effluvium, it's a little less common to have the chronic phase, but it takes some time for your body to rebuild some of that hair up. So my consultation with these patients, some people just want to, wait, and they just have reassurance that, okay, I don't have a scarring alopecia. Some other people, most other people are like, okay, what can I do to kind of speed things up, to increase hair regrowth, decrease the hair loss, and improve the hairs that I do have? And that's what I kind of go through with them during the consultation, which I'll talk about later in the video. Another form of non-scarring alopecia is medical related. So thyroid, having your thyroid off, that can cause dry, brittle hair and some hair loss. Postmenopausal, again, hormonal, that can cause your hair to be dry, brittle, and lose your hair as well. There are certain medications that can cause your hair to fall out as well. And there are certain dermatologic diseases that can cause hair loss as well. And most importantly, there's also some nutritional deficiencies, such as vitamin D deficiency and your iron storage, which is your ferritin, being off, and that can cause or contribute to hair loss. With the vitamin D and the iron, it's not the main cause unless it's really, really low, which I do see them be really low in a lot of people. But I always say it's a contributing factor, and we need to make sure those levels are good before we do anything else. So that's kind of the most common type of hair loss that I do see. And with these patients, I always kind of give them a little bit of encouragement and say, listen, your hair follicles, the entry point where the hair follicles are coming out is non-scarred, which means we can always regrow hair, or at least we can try to a certain point. If it's genetic, of course, there's a point where you kind of hit a place where there's no return, and you may have to do something like a hair transplant to get the ideal hair that you do want. But for most people that are dealing with some hair thinning, doing this route without the hair transplant, they can get plenty of new hair regrowth. And then we have the scarring alopecia, which is more of a skin disease, and I have several patients going through this. Emotionally, this is very hard for my patients because we are trying to decrease the disease. We're trying to decrease inflammation because wherever there's hair loss, that hair is not coming back. So I see them every month in my office, and there's a few different diseases. Some are related to lupus. There's one called frontal fibrosing alopecia. Those are kind of the main common ones. CCCA, that is another one. But the frontal fibrosing alopecia I see quite a bit in my office. And with these patients, we just want to make sure that if certain non-scarring treatments are not working, you're doing all these things and you're like, this just looks like it's not normal hair loss. The pattern is very distinct. It's really in this frontal line. You have redness, bumps. Typically, normal hair loss, as in the non-scarring hair loss, does not have redness, bumps, itching, irritation if the scalp is healthy. So if you are dealing with something that may be a scarring alopecia, I would say book an appointment with a dermatologist as soon as you can so we can get you checked out, because those types of hair diseases will need medical treatment to salvage the hair that you do have. And of course, there's some treatments that we can do to help promote new hair regrowth, so then we can hide the areas where you do have the hair loss. But that's kind of a whole different story there. And if there's enough interest in this, because I do have a lot of patients, medical dermatology patients, definitely leave a comment in the comment box, and I can go through a whole nother video of some of my protocols and some of the questions that you can ask your doctor if you feel like you're not being heard or being seen. So back to the non-scarring alopecia, or scarring alopecia really, I'm going to talk to you about what a consultation at my office looks like. I think this gives you a really good idea because, number one, some people think the hair is like a vain cosmetic thing, and it's really not. You can use your medical insurance to see a dermatologist for hair loss. Some of the treatments, depending on what they are, may not be covered by insurance, especially if we rule out any type of skin diseases and we feel like it is more of a cosmetic route that we're increasing the hair loss, such as, with platelet rich plasma and things like that. So some of those treatments I'll talk about later. But in general, for the assessment, make sure you want a diagnosis. Hey, is this genetic hair loss? Or is this telogen effluvium? What can I do about this? Do I have a scarring alopecia? Do I have an autoimmune disease? What do my labs look like? I think your dermatologist would be able to really cover those bases and help you. At least that's what I do for my patients. And I definitely run their labs and tell them, okay, we've done everything that we can on the medical side. All right, now let's talk about some of these other options that may be more out of pocket or that you can do at home. So number one, it's really important to first have a diagnosis. You may not need this initially, especially if you're seeing a little bit of hair loss, but if you feel like you're seeing a lot, it's falling out a lot, definitely make that appointment with your dermatologist. When I see a patient in my office for hair loss, the first thing I do is kind of get a backstory. How long has it been? Is it gradual? Is it sudden? What do your family members' hair look like? Any burning, itching of the scalp? And I get this story, because oftentimes the story will tell me if it's more of this telogen effluvium where it's a sudden hair loss, or it's kind of just gradual and it's maybe more of the genetic type hair loss, which of course you can have genetic and the sudden telogen effluvium hair loss. But if there's one, if there's telogen effluvium, I want to be a little bit more aggressive with my treatments. So then I examine the scalp. Of course, we take photos in my office too. They're kind of confidential, and we do them with the headband, we do them without the headband, and that way I can get a really good objective sense of how much hair we're regrowing with the treatments that I'm offering. We want to look for little small hairs regrowing, want to look for density, we want to look for like the thickness of the hair, and so taking photos is really, really important in my office. As I'm examining the scalp, I pull on the hair. There's something called a positive pull test where I can see if more hair is coming out depending on when they washed it. I look at the health of their scalp, which is so, so important, because there's one thing, and I experienced this myself, where if you are losing so much hair with the condition called telogen effluvium, where you're losing 300 hairs instead of 100 hairs, it is very scary, because every time your hand goes through your hair, every time you're washing your hair, you see clumps of hair coming out. And you think that all your hair is gonna fall out because of just in your head, you're like, okay, this is so much hair falling out. And every time I shower, if this much hair is falling out, you don't know that there's an end date, which there is, or there should be. You're like, oh, my hair is gonna fall out. And so people tend to not wash their hair. And I found this happening to myself when I had it like a decade ago as well, before I became a dermatologist, or right when I was in the training to be a dermatologist. I didn't know a lot of these hair diseases that much back then. And with this, it causes, if you're not washing your hair, it causes inflammation of the scalp. So people start to get dandruff, which is a fancy name, which the fancy name is seborrheic dermatitis, but it's the scaling, it's the redness, it's the itching, it's the flakes. People get like just really almost like itchy scalp. Their scalp gets a little swollen because it's oily, because there's product buildup. They're not cleansing the scalp. So this can contribute to hair loss as well. So I always encourage my patients to have a good scalp microbiome. Make sure you're cleansing your scalp with a good shampoo that's clarifying. And we can talk about some shampoos that kind of contribute to the scalp health, as well as there are some that kind of promote some hair regrowth as well. So that's really important, is to maintain a healthy scalp. If you feel like your hair or your scalp is getting super oily, super itchy, it feels inflamed, it feels a little swollen, you need to be washing your hair more. So that's really important. That's what I see a lot as well. When I do see really bad dandruff, I will treat it, and I encourage it, because we want to decrease that inflammation. So then you can think of it as like a garden. You want good soil so your good grass can grow. So you want to make sure the basis is really good, so then you get like a healthy plants, which is the hair. So anytime I see dandruff, I will treat it, and I will either treat it with a ketoconazole shampoo, something called cycloperox, or just over-the-counter Head & Shoulders, which is pyrithione zinc, and this usually, or Selsun Blue or something like that. But that's really, really important to get treated first. And sometimes I prescribe something else that will help decrease the inflammation as well. Something like a steroid or something, just very temporarily, because we really want to decrease inflammation so your hair can grow in this like setting, right? Number two, I look at the hair in general. Where is the hair loss mostly focused? Is it the crown? Is it the frontal? Is it the temples? Is it down in this area? Because there is a type of alopecia called ophiasis pattern, which is down here. So I really, really examine the hair, the scalp. I look if there's any other parts of your body that has hair loss. Look at your eyelashes, your eyebrows. I look at the condition of your hair. With my hair examination, I also look at the quality of your hair. Is it super dyed, bleached, and broken? Is it, not dyed? Is it thin? Because this can kind of give me an idea of what we can do. I look at the hairstyle. I ask you about the hairstyle. There's certain hairstyles that can cause a traction alopecia, where if you're pulling a lot in this frontal area, it can cause hair loss from the pulling, or these different styles like braids, or just maybe running, or a tight bun if you're putting your hair in a really tight bun while it's wet. And this can cause actually a scarring alopecia, where your hair cannot come back in that area. I didn't mention that before, but that is the type of scarring alopecia that starts off non-scarring and then scarring. So I look at all of that, I'm noting everything down, and then I discuss that kind of running diagnosis with you. And then I also ask if you have any special diets or anything, just so I can run some labs. I do offer to run labs on everyone. Sometimes patients have gone to other doctors, or they went to their primary care and they get labs done. They're not necessarily always the labs that I would like, because there's one thing checking iron, but then there's one thing checking your iron storage, which is called ferritin, and you want that to be above a certain level. There's one thing checking your vitamin D, but you also, even if you're on the lower range of your vitamin D, you actually want to be a little bit higher, like more in the 60 to 80 range. And I've seen vitamin D be as low as like 12 in some people. So it's really important to check a lot of these things. I check thyroid. So I go through like a whole panel and make sure that we check that, because that's going to be the most important thing for my patient. So, and then depending on what their diagnosis is, I would say one of the most common diagnoses is just genetic hair loss. I go through, and that's what we're going to go through today, because I think in other cases, you just may need extra steps, and there's no way I can fit this all in this video. But anyone who has telogen effluvium, which is that stress-related hair loss, can also take advantage of some of the genetic type hair loss improvement. The three main goals with my treatment for hair loss include new hair regrowth, less hair loss, so less hair falling out, and improvement of the hair that you do have there. It could be really thin, it could be miniaturized, and we want to grow that out into a full hair strand. So those are the three main things. And a lot of these treatments that I'm gonna kind of plan out and kind of write out that I recommend to my patients work synergistically, which means that one plus the other kind of equals like three things, because they work in such a different way in the hair loss and hair growth pattern that you kind of want to throw everything that you can, because everyone's hair loss and hair regrowth journey is a little different. Everyone responds to things a little bit differently. We don't know why. It could be one genetic hair loss versus another genetic hair loss. There's so many things that we don't know about hair loss. It depends on the age of the person, whatever else that's going on with that person. Everyone is just so different. So we kind of want to do everything that we can, and especially in the beginning, and then kind of scale back once we start seeing improvement. So of course, this is not medical advice, but I think this is a really good guide to have you understand kind of what goes through my head, and what you can prepare for when you see your doctor, and what you can kind of go through in your head as you're preparing to figure out if you should pick up Rogaine or a supplement for hair loss, or should you go ahead and book an appointment with the dermatologist. So after checking the labs, after checking the scalp and having a diagnosis, and I pretty much see that my patient has a genetic type of hair loss, we want to improve the hair regrowth, decrease the hair loss, and improve the hair that they do have, I usually start by recommending some supplements. I think that if anything, these are really, really helpful. There's a few that are more scientifically backed, one being Nutrafol. There's another one called Viviscal. I sell the Nutrafol here at my office because it's clean, patients like it. You do have to take 4 pills. It can be costly, but you have to continue some of these supplements, So we usually recommend at least 3 to 6 months. So you have to, get these every month. It's four pills. And what I really like about, say, Nutrafol is it has some ingredients in there to help decrease that stress-related hair loss, because even if you have male pattern hair loss or female pattern hair loss, a lot of that cause can be stress. That's kind of accelerating that hair loss. And then also if you have Telogen Effluvium, which is that stress-related hair loss, that's more of the dramatic hair shedding, that would be a really good idea for you to take a, adaptogen, which is something that helps decrease that stress hormone. So I do like the Nutrafol because it has the stress decreasing adaptogens. Ashwagandha is one that's really popular, that it has that in there. The male version of the supplements has like saw palmetto, and there's also a women's balance for those that are peri and menopausal, pre-menopausal, and postmenopausal. Funny enough, I've been recommending the Nutrafol Women's Balance for my hormonal acne patients who want to go the supplement route without starting like other medications, because there are a few ingredients in there, such as Derm is a really good supplement that has been shown to decrease, kind of just helps balance the estrogen, testosterone, helps balance a lot of the hormonal acne that I see. So if you're interested in that, definitely let me know, and I can leave a comment, or I can do another video on that. So let me know in the comments. Okay, so supplements for number one. Number two is a topical. So my patients can go through the over-the-counter Rogaine route. What Rogaine does, it's been one of the most studied hair regrowth, medicines out there for a really long time. It's Minoxidil. And what it does is it dilates the blood vessels going into the hair follicles and basically puts it in the growing phase. You need to be on it for at least 6 months for it to see results, and you need to be pretty consistent. So if you're gonna use it and then not use it and not use it, it actually could be more detrimental. So if you're gonna do it, I would do it. And you could even get like the Kirkland brand. Some of my patients do that who are a little bit more trying to be on a budget. There's also a prescription compound that I can prescribe my patients that don't necessarily want to go like the oral medicine route, but still want something topical because it has less or almost negligible systemic absorption. So that is a compound that has a higher dose of Rogaine, which is like 7%. The one that is over the counter is 5%. So it has a higher dose of Rogaine, and then it has a few ingredients in there depending on if I'm going to prescribe it for a male or female. If it was the male patient, then it would be something called finasteride, which I'm sure you've heard of as Propecia. Taken orally has some side effects, which we can talk about later, but taken, put on topically, people don't really see those side effects, thankfully, because it works a little bit more like local on the scalp, since it's a little dropper oil. And then it has a little retin-A on there, and then it also has latisse, which is a prostaglandin analog, which helps grow eyelashes. And so what I like about that is also kind of like darkens the skin on the scalp, so the white show isn't showing as much. So that's the male, and then for the female, it's spironolactone, which I like to add, which helps kind of this male-female pattern hair loss that you get with time too. So taken orally can have some side effects, so that's why we like to do the topical first. So that is a prescription that I can prescribe my patients, and I have them use it twice a day. With this is a really good option for those that don't have a lot of hair loss yet, or they don't want to use anything that is like oral medications yet. So I think it's a good option. You just have to stay with it. If it's genetic type of hair loss, people are like, so one thing about this medications and kind of this treatment for hair loss is people are like, I don't want to start because I have to do it the rest of my life. When you have genetic type of hair loss, say your family all has thin hair, then yes, you do want to use this for the rest of your life because you're kind of destined genetically to have thin hair. So if you use it, you get hair regrowth, and then you stop it. Studies have shown that it takes about a year to go back to baseline. So it's not going to all fall out overnight, but it does eventually. It's not like you're changing your genetics. How amazing would that be? And I feel like in the future, there will be something like that. I feel like they're really going in and finding some genes. There are some moles that have like really a lot of hair in them, and they actually found a gene recently that for people that have hair loss everywhere else, there's a gene in moles that has hair. And so they recently detected that. So I feel like they're doing some things with that. Hopefully we see something with that in the next 5-10 years. But for now, we're not biohacking, we're not changing anything with your genetics. So these are all things to kind of like trick your body into growing hair and decreasing hair loss, or at least slowing it down. So it is something like brushing your teeth. You're gonna do it for life. Even when you get a hair transplant, to maintain, because a hair transplant doesn't stop your hair from falling out, you have to maintain all these other things. So that is another thing that I see a lot of patients about, where this is like a terrible name, but my friend who's a big hair specialist in New York calls it, gosh, what does he call it? I don't remember. It's like a 2-for-1 special. So it's basically a 2-for-1 special. I hate that, but it is when someone gets a hair transplant, it maybe wasn't done properly, they didn't maintain. So they have a little patch of hair in the front, and then no hair, and then hair. So that is from the hair from the transplant, the hair loss, and then their normal hair. And it's just a way that the hair, the hair regrowth was not maintained. So I think in order to avoid that, you just have to think in your head, all right, this is something that I'm gonna continue for my life. Those are the cards that were handed to me. It's not a scarring alopecia. I'm gonna do everything I can. If this bothers me, of course, if not, shave your head, you're good to go. But if this is something that bothers you, just think of it as this is your long-term plan. If it is telogen effluvium, which is that very specific few-month stress-related hair loss, you don't have to do these things all the time. You don't have to do this hair regrowth protocol your whole life, because we are basically trying to regrow your hair that you lost a little bit faster. Your hair will come back, but not at like a fast, it'll take a long time to get back to where it was, pre-pregnancy, for instance. So if someone wants to be on these medications long-term, they can post-pregnancy, especially if they anticipate like more pregnancies in the future, or if they're on a medication that causes their hair loss. But I think in general, for most type of hair loss, it's a long-term, except for the telogen effluvium in some people. So we talked about supplements, we talked about topical treatments. The next thing that I offer my patients that is like not medicine technically, that orally, that has big side effects, is platelet rich plasma treatment. So that's a type of stem cell therapy. Platelet rich plasma is basically derived from your own blood. We do this in this office, and I'll show you guys a video here of someone doing it and some of their before and afters. It's where we draw your blood, we spin it in a centrifuge, and what's left is platelet rich plasma. And that is chock full of growth factors. And when this is injected into the scalp, it actually pulls in a lot of stem cells, and it stimulates hair regrowth in a long cascade of just so many cells, so many messengers, so many like different pathways. But with this, I would say I have like the best kit at my office. I use a really good protocol, and even with that, I tell my patients that 50% of people respond very well, and then 50% of people just do well. So there is a response to all, but we don't know how well your body's going to respond unless, until we go in and try it. So I usually recommend 3 sessions about 1 month apart. This is something that is paid out of pocket. It really ranges price-wise where you are. So here in my office in Tucson versus the Beverly Hills office, the prices are a little bit different, but I will say that it could range from anywhere from $600 to $1,000 each session, and you want to give it at least 3 sessions. Some people right off the bat recommend 4 to 6. I just don't do that for my patients, because what if there's not a good responder? So if I see that they're responding really well, both anecdotally from them and to the photos, then I sometimes will recommend another extra session or 2. And then of course with this, I recommend maintenance sessions as well, especially if you're in the genetic hair loss. If you are telogen effluvium chronic phase, then I will recommend it as well. Or if you just want really full hair, like I'll do it. I have some hair thinning and hair loss, and I do it. My office does it on me. So with this, it is, out of pocket, doesn't feel the best. It only takes a couple minutes, and you have to go somewhere to do it. So those are some of the pros and cons, but it is non-medicinal, so it is kind of more the natural route, and especially here in Tucson, my patients really like that. It's also required post hair transplant, both for wound healing as well as to help keep the hair in the kind of the growing phase. So that's really important. Just make sure wherever you go, they're just using the kits. They ask them how many cc's, you can ask questions. You can see what they're doing, the office is doing to help with the discomfort. Like we numb, and we also have Pronox, which is laughing gas. I'm the one that does the injections, and takes a couple minutes. And also tell them the areas that bother you, because if, I'm not gonna focus in the back area or on the sides if we really wanna focus on the top there. So that's really important to know. And so those are like really the top 3 that I recommend if people are just starting off, right? And they don't want to be on any types of medications. If I am considering medication, it's because they've already maybe done these 3 things, either at my office or somewhere else, and they're not seeing good results, or they're coming to my office right off the bat and they want something a little bit more aggressive due to maybe they're young and their hair loss is pretty severe, or it's really affecting them and their quality of life. So for men, I will tell them about Propecia, which is finasteride or dutasteride. I have a lot of patients on this. Of course, it's a medication with side effects. Some of those side effects can be sexual side effects such as ED. So I'm really just open about my patients and kind of tell them about all the side effects that could happen. Again, most of my patients do well, but I just don't like to leave anything out because everyone has Google, people are gonna look, and I think it just makes my patients trust me more when I'm open about them, open to them about this side effects, because everything has side effects, and Tylenol even has side effects, but I'm sure we all take ibuprofen and Tylenol and we don't look at those side effects. But I think those are really important, and sometimes those side effects are the reason why someone doesn't want to get on the medication. So that's one. For my female patients, spironolactone is not a bad option. Again, this is good for hormonal acne as well as just some female pattern hair loss that they're seeing. If we want to kind of hit 2 birds with 1 stone, that's a really good option. Oral Minoxidil, which is the oral Rogaine, has become very popular in my office, and I would say for most derms. There's a New York Times article that came out. I'll link it in the description box. This is a medication that I love. It doesn't work for everyone. Not everyone is a great candidate. It has to be like a very certain type of hair loss that is more genetic. I wouldn't say that I would recommend this for someone going through like Telogen Effluvium or anything, because it's not like a fast acting, let me just get you on it and get you off of it type medication. But it's essentially a blood pressure type medication. Like I said, it dilates the blood vessels going into the hair follicle. So taking it systemically orally, which is generally 2.5 milligrams. We start off with half, especially that's what I do with my patients, because it is a blood pressure medication and there can be some side effects with this patient. I typically have my patients run it by their primary care doctor, especially if they have any other like medical, issues. If they're already on blood pressure medications, we probably won't put them on it. If they already run low with their blood pressure, and sometimes I have mature thin women in my office that are very active and they run low with their blood pressure. If I give them to this, it could be like a fall risk or something. So I'm very careful with who I prescribe this to, because with oral medications, they work the best, they work better than topical. But again, it's that weighing the pros and cons of this could have some side effects. Maybe I should try the topical first. But I do see a lot of great results with this medication. Sometimes for men, if they don't want to be on the hormone changing medications, which is the dutasteride or finasteride that can potentially have some more side effects, I start them on Minoxidil and they do fine on that. So that is a really important kind of factor that I feel people should know, that there are medications out there. And actually those medications can be covered by insurance, which is nice, because the supplement, the topical, and the PRP are not. Now let's talk about some alternatives that my patients can try, because at the end of the day, I'm a board certified dermatologist, cosmetic surgeon, skin cancer surgeon, but I also have a big passion for integrative dermatology, and I'm certified in it and also faculty for it. And I think especially with something like hair loss, people want to be able to have control. They don't want to maybe go to a dermatologist just yet and try medicines. And I totally understand that. I will say if your hair loss is very bad, and like very severe, and falling out, or you think it's something medical, I wouldn't maybe take the time and do the supplements first. I've seen a lot of patients do that, and sometimes when they come in my office, it's not that it's too late, but I think they were just trying to treat something that it wasn't. And then also, if your hair loss is pretty severe and it's really bothering you, supplements that are more like natural, that I'll get into, they work very subtly and you have to be in on for the long run. So if you are someone who doesn't mind being on medications, then probably go that route instead of kind of not wasting time, but time is really precious, especially when it comes to hair loss, because it's kind of harder to regrow hair than decrease the hair fallout. So the younger you come in, when your hair loss isn't so bad, I think that's best. But having said that, I think it's perfectly fine to start with some of the natural things. Number one being low-level light therapy, so red light caps. That has been shown to improve, both decrease inflammation and put the hair in the growing phase. So I definitely recommend that. I have one myself, and with this is really good for people that, you know, they want to do something at home. It does something. I don't think that just using that for kind of severe hair loss is good, and also it may not help some scarring or disease related hair losses. So kind of just keep that in mind. But a lot of people ask me this, and it's vetted. It is good. Just make sure you're getting a good kind of brand. There's two brands that I know of. There's one called iRestore, and then there's one by Current Body. I was recently gifted the one by Current Body, so that's the one I use. I will say they're not cheap. So maybe wait till like a Black Friday event or something like that, because I think they do run around $800 or so. So it's really up to you if you want to save that, put it towards PRP or some other things, because that is kind of costly. Then we have some other topicals, such as rosemary oil. So rosemary oil, there are some studies that showed that it does improve and works similarly to Rogaine as far as the end result. In my experience, it doesn't work as well. And of course, there is like the smell and its oiliness of it. So I think that it really is up to you if you want to go that route, but it doesn't not do anything. So studies were showing, studies did show that there was an improvement in hair regrowth, and I will put that study down below too. So if you if you want to go that route first, because you don't want to do the Rogaine, you absolutely can, and it won't cause hair, headaches and stuff like that, as maybe the Rogaine can in some people. So you can do that. And then pumpkin seed oil orally is another option that people can take. Again, the studies aren't great, but it's an option. And again, with something like hair loss, everyone is so different with how they respond to things. And if this is something that you tried and you saw a good result in 3 months, fantastic. If you've been doing it for a year, didn't see really much, it may be time to maybe change it up a little bit or see your dermatologist. With the supplements, a lot of these are in that supplement that I recommended, but things like saw palmetto to help decrease that testosterone to the DHT, and that's what causes the male and female pattern hair loss, especially like postmenopausal or in men. So that's important. And just listening to your body, I think a lot of this is exacerbated by stress. So incorporating some mindfulness, especially when you're in that telogen effluvium where you have no control over it because it's something that happened a couple months ago. You have to wait it out. Stress will absolutely make it worse because it is stressed. It's caused by stress. And I know how difficult that is because I went through it myself. So just kind of understanding that, okay, if I get more stressed out, my hair loss is gonna get worse. So kind of just embracing it and taking control and be like, okay, this is a non-scarring hair loss. My hair will come back. Let me see all that I can do. Let me make sure my scalp health is great. Let me make sure my labs are optimum, my vitamin D, make sure I don't have any thyroid issues, my iron, make sure I'm having a nutritious diet. and then just meditating, you know, that mindfulness, whether that's you want to go for a walk or just a little bit of breathing, that really does help decrease that cortisol level. And that is so related, because with hair loss, it's so multifactorial. And I have a lot of patients that come in and they want an answer. They want one answer. And they tell me they're going through a lot of stress. Maybe their parents passed or something. They're going through like menopause, but they want to, you know, their hormones are okay enough to not go on HRT. So it's really just decreasing a lot of that stress, because it's so related, but easier said than done. And I totally understand that decreasing your stress is probably not going to be as easy as it sounds. So with the shampoos, really quick, so we talked about having a good scalp microbiome and good scalp health. There's a few shampoos. Again, make sure you just have a good clarifying shampoo, nothing too crazy, nothing too fragrant, nothing too drying. Dermatologist recommended, I would say. If you're really, you know, itchy, get something that's really like hydrating. If you use a lot of products in your hair, you want something that's really clarifying. Nutrafol has a like a scalp microbiome with the prebiotics and probiotics that helps with that scalp microbiome health. It has like a little menthol smell to it. Isden is another brand that actually has a shampoo and a hair like lotion conditioner that has some properties to help hair regrowth. Virtue is another brand they had sent me, and what I like about them is I believe with some of their lines you can use it like while you're pregnant or at least breastfeeding, because it's non-medicinal, and that's supposed to improve hair regrowth. And from the studies I remember, they had some really good ingredients in there. And then just for a good shampoo in general is Nioxin. They have a fine hair kind of line. They have a whole bunch of lines, volumizing line. So I think that's a really good option too. And of course, if you have dandruff, you want to make sure you're adding in that Head and Shoulders in there. And yeah, and I think that just understanding that this hair loss is a journey. It's not going to fix overnight, but you can definitely do something to make an effect. And that just requires you kind of putting yourself first and understanding what may be causing it. And if you don't know, we're always here as dermatologists to help you with that. So let me know if you guys have any questions and if there's any follow-ups, and I'll see you later.